Hello, beautiful mamas. Today we're going to be talking about why you should or you shouldn't be pulling away the hand out of your baby's mouth. Now, a lot of families, and also even my mother-in-law and my mom, they both want to take the baby's hand out of the mouth, but there's 4 different reasons why you shouldn't be doing that. And I will tell you why, as I am a pediatric occupational therapist of 13 years. I'm experienced in feeding and swallowing in neonatal NICU. Let's go ahead and dig in and let's talk about these 4 different reasons why you shouldn't be pulling your baby's hand out of their mouth. Now, reason number 1, and this is very surprising for many families, especially moms who are really considering baby-led weaning. And I think it's very important to know this because when it comes hands to mouth, the baby is not only particularly exploring with their mouth, but it's also very important for you to know that these little ones are placing their hands in their mouth to be able to prepare for feeding in the near future. Now, you might be wondering, how are they preparing for feeding? Well, number 1 thing is they end up lateralizing their tongue. So depending on where their fingers are placed in their particular mouth, they are moving their tongue off to the side. And this is exactly what they're going to be doing with solid foods, especially when you're doing baby-led weaning. So when they're stimulating their tongue or their mouth, their tongue can move side to side. Second of all, they're pushing back their gag reflex, and the gag reflex is obviously never goes away, but it can be hypersensitive for some particular babies. And when we end up utilizing a spoon or even a particular food item, some babies end up gagging themselves, and it obviously can be very unpleasant, especially for some parents. But pushing back that gag reflex really does help to be able to accept more foods and also to protect their airway so they don't choke. So gagging is very important. Other than that, it's very important to let them mouth their hands to be able to stimulate and strengthen their mouth, because a lot of little ones end up munching and chewing on their fingers. And also they are also feeling a different type of texture of skin in and on their tongue. So that's definitely a really good reason why you shouldn't be pulling their hand out of their mouth. Number 2, very obvious one, teething. Now, teething is something that's sometimes very difficult to know whether or not your little one is teething or not, because they end up drooling a lot. But it's also very important to let your little one soothe those gums with their hands. Clearly, you can utilize other toys and other different types of mouthing toys, but it's very important to let them soothe themselves and soothe their gums, because it's an immediate thing that they have obviously on their body, and they're able to soothe those gums automatically. Teething can happen as early as 3 months, and usually it ends up happening between 4 to 7 months. Now, usually if they're a little bit more of early teethers, they're definitely not very well coordinated when it comes to grasping items. So sometimes it's very important to just let them go ahead and mouth their hands to be able to soothe those gums, like I've mentioned before, because grasping usually doesn't come in until 4 months of age. And even within that 4-month of age range, it's a little bit more difficult for them to even coordinate and grasp for long periods of time items, and even teethers as well too. Now, a lot of families always ask me, well, Adriana, why in the world would I let my little one suck on these fingers and hands and suck on their thumb? I should be pulling away their hand because I don't want them to thumb suck, or I don't want them to damage any gums or their teeth or anything like that. But in terms of the dental association, thumb sucking usually ends up becoming a problem after the age of 4, but they end up decreasing between the age of 2 to 4 years of age, and they end up kind of letting go of this oral motor phase and development because they end up utilizing more and more of their hands, and they end up having more and more control, and they end up being a lot more coordinated with their upper extremities and their hands. So the exploration of the mouth starts to decrease as they get older. But if you do feel that your little one is thumb sucking a lot and you're very concerned about that, make sure that you talk to a pediatric dentist or even your pediatrician as well too. Number 3 is soothing. So when babies end up putting their fingers in their mouth, or one finger, whatever amount of fingers in their mouth, they end up stimulating their hard palate. And when they end up sucking and stimulating that hard palate, it actually releases the hormone of oxytocin. And when there's oxytocin in the system, it decreases the stress levels of their particular environment or whatever they're feeling, especially when they're crying. Again, sucking begins usually after 12 weeks of conception. So it's super early on when they're very, very little in the uterus. So it's very important to know that when we're taking away something away from their mouth, for something that they have constantly been doing in utero since 12 weeks of conception, it's very important not to take that away from them, especially when you're in a new environment and with different types of stimulation around that particular environment can be very overwhelming for a newborn baby. So again, let's try and be considerate of that and also not take that away from them. Number 4, they're also showing cues when it comes to showing hunger cues. So babies end up mouthing and wanting to suck, and they end up getting frustrated even when they're sucking so hard on their hand, but they're also demonstrating and showing you and trying to communicate to you that they are also very hungry and wanting to eat a bottle or to breastfeed as well too. Other ways to know whether or not your baby is also hungry is the rooting reflex. And the rooting reflex basically is when there's stimulation off to the side of their cheek and they're constantly rooting. Not only are they fingering or mouthing their fingers, but they're also rooting, and there's hyper rooting. And also when they're sucking really hard on their fingers, that's definitely another sign that they're very hungry. Other than just they're off to the side and they're just kind of exploring their hands and their fingers, and they look very relaxed and very calm. So those can be 2 different types of signs of whether or not they're hungry or not. And clearly it's also trial and error of offering a bottle or offering the breast and see whether or not your baby will take it. And if they don't, obviously they're gonna end up pulling away and refusing and go back to hands to mouth, because they could potentially be teething, or again, they're trying to explore their hands or their fingers, and again, they're mouthing and stimulating again that mouth. So these are the 4 different reasons why we shouldn't be taking our baby's hands out of their mouth. So make sure that we are respecting those cues and attempting to understand where these little ones are coming from. Again, this is Adriana. I'm a pediatric occupational therapist. I'm here to help demystify overall development and make parenting a lot more easier on you. So make sure you hit the notification bell and also subscribe to my channel so parenting doesn't have to be that difficult and that hard.